the test that we're utilizing is called myPlan. It's actually run by Myriad Genetics, and it's a study where we take the paraffin-embedded surgical resection specimen, and they take some representative slides, and they do an RT-PCR-based platform and run on gene expression of some cell cycle progression genes. That scoring system is combined with the clinical stage, and we get what's called the prognostic score. The prognostic score is stratified into high risk and low risk, and this has been validated by studies from the UK, from Brigham and Women's Hospital, and from Memorial Sloan Kettering. If the patient comes back high risk and they are stage 1B, in these types of patients we have more information to justify chemotherapy. The problem at the current time is that when we look at the stage 1Bs, we know that 20 to 30% of them are going to recur, but we're not willing to treat all of them routinely with chemotherapy. And so this is really tailoring the therapy to the patients that need it. So one of the ways that we use this test is to run the myPlan study on stage 1 and stage 2 patients. Now for the stage 1B in particular, that's that gray zone that we had talked about where there's a lot of indecision and controversy over who to give chemotherapy for. So we find that very useful. I also find it very useful on the stage 2s because we know from our data that the stage 2s have a very wide distribution of risk. There are some stage 2s that are low risk and some stage 2s that are high risk. Now, stage 2 in and of itself is an indication for adjuvant chemotherapy, but many times, every day, we face situations where we have a resected stage 2A who is relatively frail, or has a relatively low performance status, and we're not comfortable giving chemotherapy, or we're on the fence. And by utilizing the prognostic score on the myPlan, sometimes if they come back as a relatively low risk for stage 2A, we'll feel more comfortable omitting the chemotherapy. So we can use it to identify high risk 1Bs where we will push for adjuvant chemotherapy, and some low risk 2As where the patient's relatively frail and we can actually omit the chemotherapy.